Hello, and thanks for tuning into this clip and making a little bit of time for it. My name is Dr. Ollie Hart, and I'm a GP here in Sheffield, and I'm the clinical director of the Healy Plus network here in this part of Sheffield. This clip is around giving you some essential information so that you can take control of your own diabetes management and work with us to make a plan that suits you. It's all about what works for you, but we know that having really good information and understanding how your body is responding to things is a really important step in taking control of your own diabetes. So right from the start, I'd like to say that the main aim of any support we want to give you is that we hold ourselves account to improving the quality of your life. It'll be very individual for you, and it's all about what works for you. And essential in this is it's not about blaming anybody. There's no blame in this. It's not anyone's fault what's happening. It's just good to understand it. So good information really helps you to be in control. One of the key things we know is that understanding how sugar overload is causing damage in your body can be very useful. And this is what this clip is going to focus on. Key to this, though, is working as a team. We really believe that as healthcare professionals, doctors, nurses, occupational therapists, coaches and the like, want to work in partnership with you as the patients. And we're really going to ask you to contribute and join in and help us in this. And the bottom line, as I say, is the support you're getting helping you to enhance your life? So let's talk about sugar in the bloodstream. Depicting this here with sugar inside a blood vessel. And you'll be interested to know that the body is really careful about how much sugar it has in the bloodstream. In fact, we monitor a system so that there's only ever 1 teaspoon of sugar in our 5 litres of blood in a normal situation. And the way we do this is we produce a hormone, a chemical called insulin. You've probably heard about this. And insulin's job is to take sugar out of the bloodstream and help it to go into the tissues, the muscles, our brain, our tissues. And that's a really good thing for us. Having sugar in our tissues helps us to exercise, helps us to think well. We even need it to sleep well. The brain needs sugar to work properly. The problem comes as the sugar levels rise in our bloodstream, the insulin has to get to work a bit harder. So we produce more insulin, and what the insulin does is try to push that sugar into the tissues. And of course, if there's too much sugar around and the tissues are full, then what insulin does is it stores sugar as fat. And this is a really good thing. It's what insulin's supposed to do. And storing fat for later is an important part of survival. In fact, people that can do this well had a survival advantage in evolutionary terms. So actually, people that can get fat and then can burn fat later are a definite advantage. So it's a talented thing to do that humans should do. Of course, what the real problem comes is when there's just way too much sugar in the bloodstream. And here, we start to get symptoms. So the sugar in the bloodstream starts to make us feel thirsty, tired, and we wee a lot. And some of you may have experienced that. And also we know in the longer term, high sugar in the bloodstream damages our blood vessels and the nerves nearby, which causes all the sort of side effects and the problems that we associate with type 2 diabetes and pre-diabetes. And we'll talk more about that later. So of course, in this situation, insulin is really pushing hard to try and take sugar out of the bloodstream. It produces higher levels of insulin, as much insulin as it can. And of course, this tries to cram sugar into the tissues. The tissues are full, so you get a lot of sugar being laid down as fat. And we put on weight. Now, there's a point at which all of this just gets too much for the body. The insulin levels are so high, the tissues are so full, and the fat tissue is stored, and we reach what we call our fat threshold. And this is different for everybody, but at this point, you start to develop what we call insulin resistance. So these 3 areas feed back and say, look, it's no good, this is not helping, we'll stop the insulin from working quite so well because the whole system's just getting overloaded here, and we get insulin resistance. And this insulin resistance, of course, then results in us having to produce even more insulin because it's not working so well. So you get this vicious cycle of more insulin, tissues full, fat stored, makes insulin resistant. And this vicious cycle is the vicious cycle that we call type 2 diabetes. This is really the essential part you need to understand. So let's think about where the sugar comes from. Well, there's two sources of where the sugar comes from in the bloodstream. The first is what we make. We mustn't forget this, and we tend to make sugar in the liver. And this increases when we're stressed or when we have very poor sleep. So we must think about that in terms of thinking about where the sugar is coming from. But of course, the majority of sugar in the bloodstream tends for most people to come from what we eat or drink. And this is in two forms. You have the small sugars. These are the ones that taste sweet, table sugar, fizzy drinks, sweets, cakes, chocolate, where the sugars are either single or double sugars together. You taste them sweet in your mouth, you know you're eating them. And the trouble with these sugars, because they're so small, they go into the bloodstream really quickly and put a real immediate stress on this system. So a sudden flush of sugar puts stress on this insulin cycle. The other type of sugars are what we call the long-chain carbohydrates, or the starchy carbohydrates. Both small sugars and the long ones are known as carbohydrates, but we particularly talk about the starchy ones as carbs. And the trouble with these is that they don't taste sweet to us, so things like bread, pasta, rice, potatoes, but they have very large amounts of sugar because they're long chains of sugar holding hands together, maybe sometimes 200, 300 long. And when they get absorbed in the body and broken down, it creates a high burden of sugar in the bloodstream and again puts stress on the insulin system. So, although many of us are really concerned with sugar levels in the bloodstream, and it is important because if they're high, they cause damage and symptoms, actually the real problem we should be worried about is this insulin resistance and the resulting high levels of insulin that most people with type 2 diabetes have. And the problem with high insulin is that insulin, although it's useful to store sugar, when we have too much of it, it causes problems. Insulin is really the storage and growth hormone. So if it's in excess and there's too much, it causes us to get fat, but it also causes other tissues to grow, which can lead to cancer and inflammation. So it's a really damaging thing for us to have too much insulin. Good in regular amounts. Once it gets too much, it's not good for us at all. Of course, as I've explained, we put down much more fat tissue, especially around the waist, and that stops the insulin working, causes the insulin resistance to get worse. And this insulin resistance is what's strongly associated with other problems in the body. It raises the blood pressure, it causes us to have harmful cholesterol, poor lipid profiles. It causes poorly controlled blood sugar, as we said, because it just can't keep up with the sugar levels in the blood. And it causes obesity. And these things are what we call the metabolic syndrome. And as I said, it's also associated with inflammation and the other cardiovascular diseases like heart attacks and strokes. And interestingly, worse response to infections like COVID-19. It affects our immune system. So insulin resistance is a real problem. So the question we should be asking ourselves is, how do we reverse insulin resistance? Well, the most obvious thing, of course, you'll have twigged by now, is to reduce that carbohydrate or sugar stress on the system. But of course, we still need nutritious food. Eating and enjoying food is a really important part of what we do, and I'll come to that in just a second. But we mustn't forget this kind of stress, poor sleep, and the benefits of exercise to reduce sugar in our system as being part of the solution as well. And now another option is to have periods of fasting. So this is time when insulin is not needed to be released in the body. And I'll talk a little bit about this as well. And in doing these two things, what we do is encourage the body to burn the fat that we've stored or the fat that we've eaten instead of utilizing sugar. And actually the body really likes to use fat as a fuel. So if we can get into that situation, it's really healthy and good for us. And of course, if we do that, we lose fat tissue and we reverse that insulin resistance cycle. So let's have a little bit of a talk about carbohydrates and how lowering carbohydrate in the diet can be a really essential part of hitting that root cause of what's driving insulin resistance. Now, interestingly, we don't actually need any sugars or carbohydrate in our diet at all. We can make all we need. We have to have essential proteins and fats, but we don't need to eat carbohydrates at all. So you don't need to worry about going too low. Of course, as I've said, the processed sugars, so processed foods with the very small sugars, are the ones that go in quickest and are generally the worst. But we need to be mindful of those starchy carbs because we're not given the warning sign of them necessarily tasting sweet, but they have a huge volume of sugar into the system. But of course, the problem with this is that we're hooked on sugars. It's really common for people to crave sugars. Some people talk about sugar addiction, and this is not our fault. We're programmed to do this. In evolutionary terms, in the summer we were programmed to search out fruit and sugars and to store as much as we could to help us through the winter when perhaps food wasn't so available. And of course now, culturally, our processed foods, and in fact the food industry as well, has encouraged us to eat processed sugars, partly because they taste good, they're easy to produce, and they're quite trendy now, aren't they? Going to McDonald's and eating processed foods is quite fashionable. So it's not really our fault. We're programmed to eat sugar, and where it's overly abundant and too available for us, we'll just keep going. And we're marketed sugars all the time. And the other thing I think that we've got to really be mindful of is that we've vilified fat. We've worked on this whole low-fat approach, haven't we? Thinking that fat has high calories, so let's lower our calories. But actually what it's led to is this kind of like avoidance of really good, healthy fats. So the fats that we find in things like eggs, unprocessed meat, fish, olive oil, and full-fat dairy are actually really good for us. So we've got to think about how we can bring those back in our diet in a healthy way. So I said earlier on that having good information is really important, how you make your own decisions and what works for you. So we make these charts available which show how many equivalent teaspoons of sugar there are in the typical things we eat. And it might be surprising for you to think that a bowl of rice, basmati rice, actually has 10 teaspoons of sugar in it when the body's broken down these long chain carbohydrates. And look at potatoes and French fries and spaghetti. So those kind of like white foods, those beige foods we've been told in the past were really good for us, if you're in this situation of sugar overload, can be a real problem for you. And people often say, well, it's okay, I've swapped from white rice to brown rice or white bread to brown bread. But actually, although there's a little bit less sugar in them, you can see there's still a large volume of carbohydrate, even in the brown foods here. And perhaps in comparison to the green foods, let's have a look at something like a broccoli, where there's hardly any sugar that the body accesses. So it's worth just thinking about where the sugar's coming from in your foods. So the key question is, what can I eat, isn't it? What should I not eat, but what can I eat? What can I eat that I'll enjoy, that will be nutritious and interesting in my diet? So we try and think of this traffic light system of green, orange and red. So the green foods are the things that we would encourage you to eat as much as you like of, to make this the main part of your diet. So unprocessed fish, meat, eggs, leafy green vegetables, nuts, seeds, full-fat dairy, full-fat yogurt. And if you're going to drink, then perhaps try and drink more water if you can, so that you're not drinking those sort of fizzy or, and certainly not fruit juices, which are very, very processed and very, very large volumes of sugar. So maybe you'll see things on here that you would really enjoy eating. So the amber group is made up of foods that we think are okay to have in small amounts, but not too much. You might be surprised to see the fruits here. Fruits are good for us with nutrition and vitamins and fibre, but they do have a lot of sugar as well. So it's just being mindful of not going over the top with them. And the processed meats and cheeses, in small amounts to add taste and variety, are great, but just not too much of them. And then the foods that if you're in this insulin resistant situation, that's when you're trying to reduce carbohydrate load on your body, these are the things you should try and avoid. So of course, fizzy drinks and sweets, we're probably all aware of that, but then things like potatoes, pasta, rice, bread, and breakfast cereals particularly, they're all things just to be mindful of, reducing the portion size and perhaps trying to focus on some of those healthy fats and some of those healthy unprocessed foods that I mentioned in the green zone instead. Now, I also mentioned about periods of fasting. So this is when food doesn't come into your body, and it encourages the body to break down fat and to use the stored fat as fuel. And of course, we all have a natural period of fasting overnight. We tend to sort of go, 8 hours overnight when we don't eat at all, and the body's quite happy with that. So one of the tactics you can do is just to extend that fasting period. A great way of doing it is just to miss breakfast. We're always told, aren't we, that breakfast is the most important meal of the day. And maybe if you're a child, or if you're someone kind of running around doing a lot of kind of exercise, and you're not in that insulin resistant state, then maybe having a good breakfast is important to you. But if you're in the situation where you've got pre-diabetes or type 2 diabetes, and we know you've got insulin resistance, then there's a lot of benefit probably in extending your fasting period and missing breakfast, contrary to the popular advertising that we're fed. And some people like to have a 24-hour fast where they'll eat their evening meal, perhaps around 7 o'clock, a nice nutritious meal, and then they'll go across the night and across the day, and they won't have anything to eat, just drinks, tea, coffee, and then they'll have their evening meal again that following evening. And that gives you 24 hours of burning off your own fat, and that's a really healthy and safe way to do it. Having said that, if you are on certain medications, it may well be important to plan this with your GP, and you might have to reduce some of your medications if you're going to do this sort of fasting process. So you can discuss that with us, certainly in the diabetes clinic. So coming in now to land on this, and thank you for your attention all the way through this. The last thing I want to say is that it really matters that you maintain a balance in all the things that can have an effect. So we've talked a lot about nutrition and lowering your carbohydrate and your sugar stress on the system, but it's also important, as I said earlier on, to think about movement and exercise. Exercise is a great way of burning off sugar in your bloodstream, and it also has so many other benefits to your mental health and to your joints and to reducing pain and reducing stress. So it's a really important thing to include and think about. But you can't outrun a bad diet. So no matter how much you exercise, if you don't pay some attention to your nutrition, you're probably not going to manage to reverse this insulin resistance. It's also important to pay attention to the quality of your sleep and how you're dealing with stress, because all these things do matter in terms of how the body processes sugar. And we'll talk more to you about that when we're working with you. So all these things matter, and some people call these the 4 pillars of health, and I like that phrase. And of course, the final ingredient that we really mustn't forget is the ability to support each other, what we sometimes call peer support. And we will try and work really hard on this. So, it's difficult, as I said, to adjust your diet with all the kind of sugar addiction and all the kind of marketing we have. So working together with other people in the same situation to you, people who have managed to do this and had success and are feeling a lot better, can be really helpful. So we'll try and club you together in teams of people that can support each other. And we know that makes a big difference. My last slide, I would like to credit Dr. David Unwin, who's a GP I really admire, works in Southport, and he's ahead of the game with this and has applied these approaches of no blame, shared hope, and reducing your carbohydrate, and had really strong success. And it's often on the back of his lead that we've built a lot of what we do. And if you want to hear more about his work, this YouTube clip links you to his description of some of the work he's done there over in his GP surgery in Norwood. And he's publicised that over half his patients who have type 2 diabetes have been fully reversed. So they've completely come off their medications and have their sugar levels in the normal level and have reversed their insulin resistance. And that's something that we can all hold hope in our system that this is something that everyone could potentially achieve. But of course, not everyone can get there, and there's no blame in that, but I think everybody can improve things a little, and that's what we hope to do. And of course, bottom line, does it improve your quality of life and how you feel about yourself?